There's a lot of reasons you could be losing hair. The vast majority of patients that come to seek out treatment at Bauman Medical have some hereditary component to their hair loss. That's male or female pattern hair loss.
Dr. Alan Bauman is a full-time, board-certified hair restoration physician who has treated over 33,000 patients, has performed over 12,000 hair transplant procedures, and over 12,000 PRP, that's plasma-rich platelet. Dr. Bauman is known for pioneering numerous technologies in the field of hair restoration, including minimally invasive follicular unit extraction. Dr. Bauman was voted #1 top hair restoration surgeon in North America by Aesthetics Everything for the 7th consecutive year, and received the 2022 Lifetime Achievement Award in Hair Restoration. He was also recognized by Forbes as one of the 10 CEOs transforming healthcare in America.
When you change your caloric intake, your hair follicles can sometimes respond to that in a negative way. DHT is the primary trigger for male pattern hair loss. The other thing I focus on a lot is sleep. I lost weight and I felt better. I had a lot more energy. First things I changed was...
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better, so you and your friends can live beyond the norms.
Welcome to the next talk on the Uncovering the Secrets of Longevity Live Beyond the Norms Health Summit. An estimated 80 million Americans, which really maps to about 50 million men and 30 million women, are suffering from some level of hair loss. This is traditionally associated with aging, and as we think about longevity, we have to start thinking about living longer and considering the emotional challenges people face as they do start losing hair. In fact, a quick search on NIH shows impacts like anxiety, anger, depression, even responses as severe as suicidal tendencies. This is something that we want to handle, and our next speaker is just the doctor to do that for us. Dr. Alan Bauman is a full-time, board-certified hair restoration physician who has treated over 33,000 patients, has performed over 12,000 hair transplant procedures, and over 12,000 PRP, that's plasma-rich platelet, since starting his medical hair loss practice, Bauman Medical, in 1997. Dr. Bauman is known for pioneering numerous technologies in the field of hair restoration, including minimally invasive follicular unit extraction, VIP and I may be like butchering that, no shave hair transplant, low-level laser therapy, PRP, we already covered that. He calls it PDO Grow, eyelash transplants, and his latest needle-free, pain-free treatment for hair shedding and hair loss, TED, that stands for transepidermal delivery. Dr. Bauman was voted #1 top hair restoration surgeon in North America by Aesthetics Everything for the 7th consecutive year, top hair restoration surgeon of the decade, and received the 2022 Lifetime Achievement Award in Hair Restoration. He was also recognized by Forbes as one of the 10 CEOs transforming healthcare in America. Dr. Bauman, thank you so much for joining us today.
Well, thanks for having me, Chris. I really appreciate it.
Now, I have to ask, right?
Yes.
Do you tend to look at people, you start assessing hair? Because I feel kind of, I don't know if you've ever been around, you find somebody, they're a dentist, and if you're happy with your smile, you smile. If you're not so happy with your smile, and you know that they're looking, do you find yourself doing that?
Well, of course I'm attracted to hair. I love hair. I love my own hair. I love everybody's hair. I'm fascinated by hair, and it's, it's been my life's work. So of course I do look at everybody's hair, and there's just, not too many ways around it. But, no, if I meet you for the first time, of course I'm going to look in your eye and develop, a relationship. But, I do look at everybody's hair. That's my job.
So you don't start off with some sort of monkey grooming.
Oh, no. If you would like a consultation about your hair, then obviously that's something that we start here in the office.
That's awesome.
One-on-one private consultation. Then I get to monkey around. Really figure out what's going on. And by monkey around, I mean AI-powered microscopes, of course. But you get the idea. That,
Can you start off by giving just a little bit about your background? I think you had some early experiences that led you in the direction of plastic surgery, but how'd you end up ultimately focusing on hair?
So I didn't know anything about hair restoration really as a burgeoning cosmetic surgeon. I was mentored at an early age by a very prominent plastic surgeon, and I was in my surgical residency going towards that goal of doing something cosmetic with the surgical skill. And I met a patient who had had a hair transplant, and he was getting something else done, maybe an eyelid lift or something like that. And he told me that he had had a hair transplant. And I'm looking at him, I'm looking at his hair, trying to figure out, well, what's been transplanted? And I guess, in the 1990s when that was happening, I figured I was just like everybody else. I thought hair transplants were kind of pluggy and probably painful. And why would you ever do that or perform that? And his results fooled me. They didn't look like a hair transplant. So we got into a brief discussion about it. And we talked about how he researched the surgeon that he went to, and he told me in layman's terms about single follicle implants. And I looked at his hair and I was just, blown away. I was like, wow, that's just amazing. And of course he was elated that he had fooled the surgeon. At least I was, resident or whatever. But I remembered in my mind, actually, that conversation going a little bit deeper into how it changed his quality of life, both socially and professionally. For him, I would say the way he described it, things were never the same again. It really changed his career path. He got more confident, at work and of course, socially as well, and married with kids at that point and all of this business. So just like you mentioned in the intro, hair loss can really affect somebody's quality of life. And here was a great example that I learned within just, less than 20 minutes, how natural a hair transplant could be and how life-changing it could be. And I felt that maybe that was something interesting. I should probably chase that down a little bit. And I didn't know much about hair, and it certainly wasn't available to look at in the hospital setting where I was working. But eventually I went down that path, researching it essentially, looking at textbooks and then journal articles, and then going to conferences that had cosmetic and hair procedures and live surgery workshops, and visiting physicians around the country and around the world eventually, and really learning a lot about it, and eventually getting the opportunity to do a fellowship in hair transplantation, and then eventually deciding that that's what I really just wanted to focus on. Just wanted to do only hair. And at that time, not too many people did that. In fact, I never really asked anybody, but they probably would have said, no, nobody focuses exclusively on hair, but that's what I decided I wanted to do.
That's really cool. So you started your practice in 1997. You've been delivering success for decades. But when I see your interviews and you have this absolute passion for the latest and greatest processes and procedures, you're actually coming up with new ones on your own. I'm not sure that's normal, like in hair space, maybe in a lot of spaces. What drives you to keep coming up with the new stuff?
Yeah, I know. I've always been kind of an early adopter, whether it was trying to get follicles out, one at a time from the back of the scalp without using a strip harvest or extraction method like that, doing something less invasive. I was born and raised into the world of general surgery and laparoscopic surgery at a time when it was just coming available. And I felt that hair transplants could be less invasive than taking a big strip out of the back of your head, essentially. But I've also been, technology oriented. I was, had a computer since I was, 9 years old, and programming, and I've always, had the latest phone and you name it. I've just always had kind of a curiosity in that way. And, when there's things like regenerative medicine that have really come available, from stem cell therapy to the latest and greatest in exosomes and peptides and growth factors, like you mentioned in the intro, I've always been attracted to that. And that's always been a part of my practice. And in fact, I know this is a longevity podcast. I've been a member of the American Academy of Anti-Aging since 1998.
Wow.
So I don't know. I can't explain why I've always been that way. That's just part of my.
Just how it is.
I'm just always trying to bolt on new, improved things. And I guess that's a simple filter, right? So if it's good for the patient, then I want to know about it and I want to test it. And I can't say that everything we've tested has been successful. Of course not. Thomas Edison tested how many tens of thousands of light bulbs, right? But and I have a closet full of equipment that we no longer use. But through that iterative process, we've discovered things that have worked. And, and I think we've got it down to a science. And so that's why, 12,000, almost 13,000 surgeries later, we're able to deliver great results.
That's brilliant. Now, you said computer programming at 9. That had to be like Commodore 64. Was it?
TRS-80, baby.
Yeah, I was a
Yeah.
Commodore 64, so the good old days.
I
And
was
by the way, for a lot of the audience who's listening, that was 64K.
That's right. That's
All
so
right,
true.
what?
And we had, all the programs were on like a little cassette at the time,
Yep.
And so that was, I went to a sleepaway camp, and I was, that was one of the things. They had a little computer lab. And so instead of throwing frisbees around, I was, for some reason, I was learning how to program. And I came home that summer and I told my dad, oh, we got to get a computer. He's like, well, what is it going to do? I'm like,
Entertain me.
I said, it's going to do everything eventually. But so that's why we got to get on top of it. So it took a little convincing, awesome. But we went from a TRS to TRS-82 Radio Shack, right? TRS-82, eventually Apple II Plus, and big 5.25 floppies and all that business.
All that fun stuff. All right. So what are the main causes of hair loss? The cause that the average person, male or female, might have to be dealing with?
Yeah. So, I mean, there's a lot of reasons you could be losing hair. But in the practice, what we see primarily is a genetic tendency. So the vast majority of patients that come to seek out treatment at Bauman Medical have some hereditary component to their hair loss. That's male or female pattern hair loss. Now, there could be a lot of things that dysregulate the hair follicle, from autoimmune conditions causing alopecia areata to certain hairstyling habits like pulling and traction in braids that can cause traction alopecia. Sometimes we see injuries or trauma causing scarring alopecia or cicatricial alopecia. So there's a lot of different types of alopecia, which is a general term for hair loss, as well as all the health and wellness situations that you can imagine, because hair follicles are a very highly metabolic cell population. Anything that disrupts your nutrient or fuel intake, your sleep-wake cycle, your whole body inflammation, all of these things could dysregulate your hair follicles, creating problems and exacerbating that underlying tendency, if you will, to genetic hair loss or androgenetic alopecia. That's what we typically see.
And how does that kind of lay that out as a difference between men and women? Because I think that they tend to experience different things.
Sure. Well, male hair loss is obviously very visible from across the room. You have a typical receding hairline. The hairline's marching backward due to hair miniaturization. The follicles are weakening. You could see a balding pattern happening in the crown usually. And you could actually lose all the hair from front to back to the, all the way through to the crown if you have a severe male pattern hair loss process. And that preserves, though, the hair around the sides and the back of the scalp. In fact, that's what my dad has. He had extensive male pattern balding. And obviously, we fixed him with a hair transplant eventually. But in women, it looks a little bit different. The genetic tendencies in women don't give you the same look from across the room, so to speak. They have a more diffuse hair loss problem. Typically in the front and center, you might see a widening part line. They may experience more shedding because typically their hair is long. They may see more shedding. They'll experience a weaker ponytail volume over time. Their hair texture may change. And if you measure it, you can certainly see the miniaturization happening in that frontal zone. But it's not till later on do they actually kind of recede in the hairline and lose the temple areas. It's much later. But typically around the sides, and especially in the back of the scalp, we've measured that the density and the quality of the hair stays very, very consistent and constant. And so I guess we say, like in women, they don't necessarily look like they're having a balding problem, but 50% of the hair could be gone before it's noticeable to the naked eye. So when women go to their dermatologist, sometimes the dermatologist will say, oh, yeah, you look fine. Here's a bottle of Rogaine. I'll see you later. But when they come to us, we believe them and we measure and we know that hair loss can occur like invisibly. And we say invisible baldness, which is the loss of hair that's not visible to the naked eye. We see that with the microscope. And the good news, though, is that we can treat all of the above and that there are very highly effective treatment options for both men and women to stop the progression of androgenetic alopecia, male or female pattern hair loss.
And so you mentioned kind of early on AI microscopes. You were talking about measurement. When you're taking measurements, like what are you looking at? Like what are the specifics? Because I'm a geek.
Yeah. So
I had a Commodore 64.
Right. So in the early 2000s, I had the first video microscope. It was made in France. It was a PC based microscope, so it was a big machine, and the handheld unit was about the size of a half of a football, and you put it on the scalp to see the density, and there was no way to count the hairs. But today we can take a dermoscopic photo or trichoscopic photo, right? That's a photo of the hair and scalp at a high powered magnification. That photo then gets loaded up to the cloud. It goes to a centralized computer and then comes back down. And it has a hair count attached to it. So each area of the scalp can be assessed in terms of the numbers of hairs per square inch. It can also assess the quality of the hair, which means the thickness or the diameter of each individual hair. So in a condition, let's say in male pattern balding, we would look at the back of the scalp. Obviously, that's going to be the control zone where the highest density and quality of hair exists. And then we're going to look at the other zones, maybe the crown area where there may be some thinning, but it's not yet visible. And so we'll see what the density looks like there. And then we'll look in the frontal zone and the temples. Obviously, if they're receding, that's going to be very, very depleted. And we're going to see this miniaturization, the weaker, wispier, thinner, shorter hairs in those zones where male pattern baldness is taking effect.
So, and I think I believe you had a big booth at the biohacking conference, right? I walked by it and you had the equipment. You were actually doing those initial kind of assessments that I just thought I didn't get a chance. I didn't have time, but I thought that was pretty cool to make that available.
Oh, yeah. I mean, we could do that in a moment's notice. Like within minutes, you could have that assessment, as long as we're connected to the Wi-Fi, essentially. We'll have the ability to do that. And we often do that at the biohacking conferences. Dave's conference, we did in California a couple of years back, and then obviously Orlando. We're at the Biohacking Congress in Miami. We're doing it there. But that's one of the features of coming to see us at the booth. If you're at one of those conferences, you can get that initial evaluation with the AI-powered microscope. And there's plenty of other ways to assess the scalp as well, not just with that data. We can also do hair bundle measurements, which we call cross-sectional trichometry. And essentially that becomes a baseline. So if you came by the booth and we did some measurements, well, you see us next year, we can repeat those measurements and see if it's any different, depending on what therapies or treatments or lifestyle changes you've made.
And okay, so you mentioned lifestyle, right? So some therapies, how much does lifestyle and I'm going to even throw in microbiome have to do with like hair loss?
Okay, so there's a lot to unpack there, but lifestyle, lifestyle issues. Yeah, so let's just start with some easy lifestyle stuff, right? So probably one of the most common things that we see in the world of health and wellness, and if you want to call it biohacking, is intermittent fasting or dietary control of caloric intake. And when you change your caloric intake, your nutrient and fuel intake, your hair follicles can sometimes respond to that in a negative way. And so patients that lose quite a bit of weight, whether it be on purpose, like with bariatric surgery, right, stomach sleeves and stapling and such, or through medications like Ozempic and things like that, or through changing their regimen, whether it be exercise or diet. And if they lose a certain amount of weight, they can definitely trigger a shedding phase. Your body will respond to that. Your follicles are, as I mentioned, the most highest metabolic cell population in your body. They have the highest mitotic rate, which is cell division, right? And so if you deprive them of nutrients and fuel, your body will then, use those the nutrient and fuel nutrients and fuel that are available in the more, let's just say, important or urgent matters, internal organs, let's say, other than your skin and hair. So that's one of the ways, you can see hair shedding occur spontaneously if you lose a certain amount of weight. So, fasting for multiple days and things like that can certainly trigger a shed. But there's other things that can trigger sheds, such as jet lag. So disrupting your circadian rhythm, working night shift, or having, if you have insomnia or some other sleep dysregulation. Oh man, that's going to mess up a lot of things, as you probably know. Not just your nutritional status and your weight management and your blood pressure and everything else, your recovery from exercise and activity, but certainly that can mess up your hair too. So we see shedding from that. You mentioned microbiome, and we always think of two different microbiomes, essentially, the skin and scalp, obviously critically important. If you have inflammation at the level of the scalp, usually, or let's say dandruff, for example, or irritation, there's some disruption of the microbiome going on there. We know that Malathesia, which is essentially a microorganism, a fungus overgrowth, can certainly dysregulate the skin, so you get these flakes. And if you have an excess of sebum or oil production at the level of the scalp, you have itch flaking, these yellow flakes, that's not so good either. That can disrupt hair follicle function and disrupt the way that the hair follicle is producing the hair fiber. But the other microbiome is obviously in your gut. And there's been some interesting studies that show that certain supplements and probiotics can actually assist with hair regrowth. And there's some interesting studies on that came out of South Korea, I believe, on kimchi actually, and some of the fermented foods that are popular there, and how that could affect hair growth. But so we're very keen on keeping whole body inflammation down and nutrient transport across the gut lining, and so that would be with an oral supplement, like a probiotic, and then taking care of the scalp microbiome in an appropriate way. I have an entire department that's dedicated to that, called a trichology department. Trichology is the study of the scalp and hair.
Very, very cool. So this popped into my head earlier. I want to make sure I don't forget it. And you talk about a lot of it's genetic. Are we trying to identify in the genome these things that cause? We'll just talk about male pattern baldness because I'm a guy. And are we looking at those and then are we thinking about solving them with maybe a CRISPR technology? Is any of that on anybody's radar?
Well, a couple of things. Well, first of all, we know the genetic tendency towards sensitivity of the hair follicle to your androgens, right? So, for example, DHT is a metabolite of testosterone. Dihydrotestosterone is created in the body from testosterone. DHT is the primary trigger for male pattern hair loss. And so we know that that's what's inherited, the sensitivity to the DHT, right? So if you're highly sensitive to DHT, you're going to lose your hair faster and quicker and earlier in life. If you're less sensitive to DHT at the level of the scalp, then you're going to maintain your hair much longer. That's not to say that you're going to escape hair loss over the course of your life. It may just happen slower. And so one of the interesting things that we've done over many years, I was the first board certified hair restoration surgeon to actually provide genetic testing for hair loss, which looked at androgen sensitivity, both men and women. That was well over a decade ago. But more importantly, today, genetic testing in our male and female patients can elucidate different metabolic pathways that might be affecting hair and hair growth. So, for example, even simple collagen production and how it's related to your metabolism, as well as maybe your propensity to create that DHT from several different pathways, or your ability to metabolize and convert the minoxidil that comes out of the Rogaine bottle into minoxidil sulfate at the level of the scalp. So these are all pathways that we can look at genetically by doing genetic tests. Simple cheek swab comes back in about a week, and that can help us create a personalized precision medicine approach to your specific hair loss condition.
Wow. So you're looking at the genes really from a treatment perspective. Anything happening on the CRISPR, like that's
so gene therapy.
Yeah, if you're thinking about gene therapy, I know hair is probably, it's high on your radar, right? And everyone walks in your door. But like those people who are currently trying to do cutting edge things with CRISPR aren't focused on hair, I would suppose.
Yeah, we don't have anything off the shelf that's ready to go, or any YouTube video on how to do gene therapy for yourself. But I will tell you that there's some interesting gene therapy related treatments that are coming available. Small interfering RNA are very tiny molecules that are basically silencing molecules. And so if you can silence the androgen receptor at the level of the scalp, that would be helpful, we believe, in treating hair loss. And actually, there's a cosmetic product, believe it or not, that's approved in Europe called Cosma RNA that, they say they have the studies to show that it's helping with hair loss. Now, I don't have too many patients here because they have to get it from the UK, and it's more difficult to get that into the United States at this time. But maybe we'll see some more data on that, and that might be some window into what we would say like genetic therapy, if you will. That might be helpful. Silencing those androgen receptors through siRNA.
I find that fascinating and think we're going to be accomplishing amazing stuff. And then you throw AI at it, and as scary as AI can be, it's also pretty freaking amazing. So All right, so let's talk about solutions, like solutions that you typically provide your clients. Like what are let's start like least invasive, like hey, you're actually good, all the way to like what is the most invasive, and I would assume that's hair transplant. But
Sure, sure. So, if someone is here in the office, obviously we mentioned that we're going to do that assessment, looking at their scalp. We do those measurements to know exactly what's going on. Make sure we have the correct diagnosis. Are we dealing with a hereditary hair loss process or something else that's being exacerbated? It's exacerbating the male or female pattern hair loss process in terms of lifestyle and styling habits or scalp health and things like that. We want to definitely address the androgen sensitivity issue. If you're a man, we need to talk a little bit about how we block the formation of DHT. Now, whether a finasteride or dutasteride is appropriate for everybody is a matter of debate. But for male pattern baldness, it's obviously a key tool in the toolbox, because lowering the DHT level has been shown to be very effective in stopping the progression of hair loss. And in 98% of patients have no side effects from that drug. If you're concerned about sexual side effects, we convert that into a topical medication, which has much lower systemic absorption and kind of avoids that. Other therapies could be topically applied minoxidil. That's the other FDA-approved drug that's in Rogaine, but obviously compounded versions of that are going to be a lot more powerful, a lot more palatable on the scalp. Things like 82M is a very, very well-known compounded version of minoxidil plus tretinoin and fluocinolone, which is an anti-inflammatory, and that works very, very well. It's our most popular Rogaine alternative. It's much better tolerated. It's not greasy or gooey. And then, as I mentioned, the topical finasteride is 82F. And then we also have topical dutasteride. But getting away from pharmaceuticals is something that a lot of folks are interested in. So they want to use something either nutraceutically, and so they can use saw palmetto to address the DHT, use things like curcumin turmeric to reduce the inflammation in the body. They can use protein collagen to boost their protein intake. Things like, for example, ashwagandha reduces the effect of stress on the body, and that's been very, very popular around the time of the pandemic, of course. People are kind of locked down, locked away, shut down, unable to exercise and get out and about. Social contacts were minimized. And then, other non-chemical at-home therapies, red light therapy. So low-level laser light is a very, very popular way to apply the concept of photobiomodulation to the scalp to increase circulation, decrease inflammation, and to improve hair growth. And we certainly have some very, very powerful head-worn, portable, powerful laser light devices like the Turbo Laser Cap, which is a great device. It can help with healing after a hair transplant and also FDA cleared for hair regrowth. And so that's a very, very popular item for people to use at home. Now,
so you mentioned stress was thrown out in there, and I had jotted this down earlier. People often say, like, I got gray hair because of stress and maybe even hair loss. Like, how true is that?
Well, here's the thing. So, exposure to cortisol is not so good for just about every organ system, right? I mean, it's a hormetic stressor. We need cortisol to do what we need to do. And as a stress hormone, if the lion is chasing you, you better have enough energy to run. But chronic exposure, obviously, to stress or perceived stress, reduces the ability of the follicle to produce good quality hair. And there's some anecdotal reports that it could dysregulate the melanocyte function. So I just heard a great lecture actually in New Delhi a couple of weeks ago.
Melanocyte function. What is that?
Melanocytes are the pigment creating cells that are within the hair follicle.
Okay,
so the melanocytes are the ones that deliver the pigment directly to the hair fiber. And so if the melanocytes shut down, then that's where you get gray hair. So there's a lot of interesting things out there now that could be potentially helpful for gray hair. There's no real solid science. There's some, old school, let's say ancient Chinese secret herbs that are, been, used for centuries for that, as well as some newer modalities. I think our best effort in terms of reversing gray recently has been one of our regenerative treatments, like the TED, transepidermal delivery of growth factors and peptides, like copper peptide, for example. I think has been showing some really nice results in our patients. We've been seeing some nice repigmentation as well as the hair regrowth with that non-invasive therapy, certainly more than our PRP treatments we're doing. The PRP is certainly great for hair regrowth. That's a 1 hour in-office treatment, as you mentioned, platelet-rich plasma. But the transepidermal delivery serum seems to be the one that's also repigmenting some of the hair. So we're keeping a close eye on that. We're trying to measure it. It's not so easy. So stay tuned for some of the data on that. We've got good data on hair growth from both PRP and from the TED, transepidermal delivery, those in-office treatments. Still trying to figure out how to quantify the repigmentation effect.
And so TED, transepidermal, is that it's topically applied, or is that have some other kind of components to it?
Yeah, so transepidermal delivery is a very cool technology that uses a method called sonophoresis, used to be called phonophoresis, which is ultrasonic sound waves that disrupt the moisture barrier of the skin, the stratum corneum. So stratum corneum is basically that small 10 micron layer in the skin that keeps you from expanding like a sponge in water when you go take a bath or dip in a pool, right? We don't absorb water like that. And the reason is because of the stratum corneum. The water is supposed to roll right off, right? It's good at doing that. It also keeps out a lot of treatments that we may want to try to apply to our skin, for anti-aging or other therapeutic reasons. The copper peptide, the growth factors like FGF, fibroblast growth factor, the VEGF, vascular-endothelial growth factor, and a thymosin beta-4 derivative are the key components of what we call the hair care serum, or the TED Plus hair care serum that's applied through the skin in that in-office treatment, which takes about 30 to 40 minutes.
Very cool.
Yeah, patients will come in for that once a month for 4 months, and we've got some really, really good measurable and visible results from that. And that's why I was in overseas there at the International Society of Hair Restoration Surgery presenting that preliminary pilot study data. So very exciting stuff.
That's just, by the way, that's just got to feel good, right? Like to be doing these procedures and they come back and, they're addressing the pain points, like the emotional pain points. It's just got to be, you must be excited to get to work every day. And maybe that's the answer to my question. That's what drives you. Like if I could amplify those results, then I'm happier, right? Like that's really cool.
But yeah, addressing the hair loss situation, obviously preventing further hair loss and even regrowing some of the existing hair without going to a hair transplant. Obviously, that's a key component of the practice. Because even if we do transplant your hair, taking follicles that are permanent from the back of the scalp and moving them into the thinning or the balding area, that's not a permanent solution per se, because you could lose the other hairs. And so patients have to be very, very cognizant that hair loss is a lifelong battle, and we're going to have to need to do something in the long run. Well, if it's not medications, then certainly laser light or regenerative treatments like the PRP and the TED type therapies over the long run to maintain the function of the non-transplanted hairs. But yeah, those things are life-changing. When you restore somebody's hair, as you mentioned, we've conquered the problem. When the shedding has stopped, and you see that regrowth on the photography, and they feeling that thickness and fullness in the mirror. They're styling their hair differently again. That's what really feels good.
Hey, super quick break from the podcast. Hopefully you're loving it. This is a way you can support the podcast and take advantage of a great offer. We're offering 50% off of one of our MCT bottles. MCT is an amazing oil. Add the ESS 60 molecule to it. It's even more amazing. All you got to do is leave a review on iTunes, send us a notification that you've left that review. We'll get you a coupon code that'll get you 50% off of our MCT oil and free shipping. Back to the podcast.
Yeah, absolutely. I think I read somewhere that massage, something as simple as massage, and this is like a 20-minute massage, and you could massage your own scalp, was of value.
It's true. We used to think that massaging the scalp was kind of a myth, like along with like letting the cow lick your head, on the farm. That was another myth that was out there for many, many years. But here's the thing. There's always a little grain of truth, right? In those anecdotes. And here's why. Because the massage, they know now that movement of the skin is a mechanical trigger. And the mechanical trigger within the skin increases blood circulation, maybe temporarily, but also sends a signal to the hair follicle to activate. And so there is something to it. Now, we could take it further if we do a little bit of microneedling. Obviously, we have those tools that you could do in the office along with a PRP, mechanical microneedling. You could do a manual microneedling at home along with topical medications. But those types of things, and that goes back to the cow licking, literally the cow lick, right? To treat the baldness. If you do a little bit of perturbation, as we say, a little bit of irritation to the skin, the skin therefore responds with growth factors, increased circulation. And if you do it the right amount, not too much, but in the right frequency, you can actually improve hair growth. So those little hormetic stressors, whether it be irritation or microneedling or micro wounding, if you will, that definitely can improve hair growth for sure. We've seen that again and again in the clinical trials.
And I would assume that if I'm saying this right, the sonoplasticus, right, which is one, helping you get that solution past the water barrier, but is two, has to be kind of perturbating stuff as it's occurring.
So that's interesting. So sonophoresis, is the technology to push those larger molecules through the skin. But a lot of folks have asked, does the vibration, the ultrasonic sound waves, does that have on its own some kind of biologic effect on the hair follicle? And even though we haven't seen the data in humans to demonstrate that per se, there are some studies in mice that show that ultrasonic sound waves can affect hair follicle function. So I'm not going to be surprised if we do come up with that.
You just brought up mice. I have to ask this because I know I've dug into this subject at some point, and where if you've got to be careful about, especially with hair and what might work on a mouse. I mean, this is true all across the board, but specifically with hair, because mice aren't subject to alopecia the way that we are. Can you talk about that a little bit, and we'll get a little geeky science here?
Yeah, for sure. So, it's kind of I guess a joke in the industry that, the mice respond to just about everything, right? You could yell loudly and the mouse grows more hair, and so a lot of things that happen in mice, for some reason, they just don't necessarily translate to humans. And that's a big problem. Although there are, at least some good basic science out there, some good studies that show, at least gives us an idea of things to kind of start to chase down, if you will, what is actually working. And so just as an example, I helped develop this technology called PDO Grow, which in this country had never been done before. It was the use of these tiny, thin filaments of absorbable material called polydioxanone in under the scalp to stimulate hair regrowth. And we didn't really know exactly how that worked. I had heard about it through a conference in the Far East, and I knew they were doing some preliminary pilot studies in India and South Korea, but I couldn't find anything in the US. And so I decided to try it. We launched a small pilot study, friends and family, to see what was going on there. And it was interesting. We saw some amazing hair regrowth happen with that technology within about 6 to 12 weeks. And then doing some additional due diligence, I found in the clinical literature, there were studies on mice and polydioxanone and hair growth. So, if we still would have we still did the trial on humans without knowing about the mouse studies, but in further research, we're like, oh, well, maybe this explains how it's working,
Yeah, and I think we often my product what the research that we have is on Wistar rats, right? And mm-hmm. Like one of the things I have to explain to people, there's a reason we look at mice and there's a reason we look at rats, right? Like there is applicability. It's not 100%, but there is applicability. I think that makes it. And I was recently at a Supply Side West, which is a whole ingredient nutrition. I don't know if you've ever gone, the thing's huge. And I went to a talk and they were talking about spermidine, and they had like two kind of positive papers, kind of the classic peer-reviewed double-blind. I don't know if that's on your radar.
I have seen those papers. Spermidine has been talked about at a lot of the biohacking conferences, for many, many years as an adjunct to the fasting and so forth, and an autophagy promoter and so forth. How exactly that works for hair regrowth, I'm not quite so sure. So I don't know how to necessarily connect those dots in my mind yet. So if you have any suggestions, or if anybody listening can tell me how that mechanism might be explained, I would love to hear that. But yes, I have seen the hair growth studies on spermidine. Yes.
And you've probably seen it on all sorts of stuff that you've also opted probably not to include.
Yeah, well, listen, if we included everything that had a little study on hair regrowth, we'd be handing out pumpkin seeds and all, and rubbing rosemary oil and everything. But there may be some grain of truth to some of that research there. But what's practical? Patients want to really know what's going to really move the needle for them, and so it's important as a physician not to we're not tossing out the evidence that's out there, but we want to try to, pick our battles. What's going to give us the best result? What's the biggest bang for the buck, so to speak, in terms of effort, resources, and so forth. And really be, really brutally honest with patients. And look, if you need a hair transplant, this is where the hair transplant is going to take effect. And this is, where it's going to work best. And here's another area which is very weak, but not appropriate for hair transplantation. This is where we need the other types of therapies.
Mm. Kind of in the line of things that you can do, I kind of jotted down the final solution is hair transplant, right? Like we've got to jump to the heavy hitter, right? Talk a little bit about, you were talking about strips, right? You used to do strips and talk about that, please, because I think that's interesting that's kind of migrated and actually what caused that migration. I think that would be fascinating and maybe give whatever details people might be interested in terms of having an individual hair transplant.
Yeah. So, a quick history of hair transplant. The reason why hair transplants were called hair plugs is because originally surgeons were taking literally a 4-millimeter punch biopsy tool, right? That's about the size of a pencil eraser, harvesting a plug from the back and putting it into the bald spot in the front. And so if you look back at Joe Biden's early days in the Senate, you could see his row of brown plugs right across the front of his head. He had that procedure done. Now, of course, as the hair goes gray, they become a little bit less visible, and he's probably had a touch-up since then. But the point is that was very unusual looking. But the patients that had it were actually pretty happy about it because now they have something to comb.
Yeah.
And so we went from that kind of harvesting back in, let's say, the 1960s and 70s to a strip harvest procedure in the 80s and 90s. And so the strip was how we got the hair follicles out of the back of the scalp, and we're all trained on that. So a strip would come out, the gap was sewn or stapled shut, and you'd end up with this line in the back of your head. And so you may be seeing people like at the gym or whatever, and they have a short haircut and they have a line in the back of their head. It's like, that's not from brain surgery. Well, they may tell you that, but it's not from brain surgery. That's from a hair transplant. But in the early 2000s, I was amongst a number of surgeons, maybe about 6 or 8 of us around the world, that were trying to do this process less invasively. So could we get the hair follicles from the back of the scalp without cutting that strip? And so do we need something that's, the diameter of a needle, let's say, something that's literally less than 1 millimeter wide, to be able to pluck the follicles out one at a time. And we needed upgraded equipment. We needed upgraded magnification. We need better lighting. We needed all sorts of tools to make this work. And eventually, we did. We were able to make this work. There were surgeons who were ahead and behind and caught up. And then there's mechanical tools. And eventually in 2011, there's robotic devices to help us do this. And now there's mechanical, programmable, rotational machines that help us, literally pluck those follicles out. But all of that is technology to help get the follicles out of the donor zone. That has nothing to do with the artistry of putting them in and designing a natural hairline. And so you could be very proficient at harvesting, but not very proficient at delivering an aesthetic result. And that's where the craft of hair transplant comes in. So a patient once explained to me that a combination of something that requires technology or technique as well as artistry, that's a craft. And so hair transplant, in my opinion, is a craft. It's part art, part science. And so designing a hairline in the appropriate, age-appropriate shape, getting the hair angles one at a time in the correct angle, orientation, and position, that's what's going to make a hairline look undetectable, something that looks like Mother Nature created it, not like a surgeon created it. The last thing we want to see is some kind of straight line across the front of your head. And unfortunately, there are many, many, many clinics, many, distant, what I would say, medical tourism destinations in underdeveloped countries that are promoting cheap hair transplants. And unfortunately, a lot of patients from all around the world are going to be needing a lot of repair work and unfortunately, maybe even a lot of antibiotics going to those types of clinics. But so my point is that there is a lot of art and science, and it's been very exciting to be on the front end of FUE, which is follicular unit extraction that you mentioned in the intro. And that's the technology that we use primarily to move hair follicles around for the scalp and also for eyebrows and even eyelashes and other areas that may be scarred, like sideburns, or to improve facial hair and beards and mustache.
You mentioned repair. I have to assume that repair is harder than getting it right the first time.
Well, yeah, absolutely. If you're in the need of hair transplant repair, that's an art in and of itself, because most patients who need repair have a number of different problems. A lot of it has to do with how much donor hair is left, because it's a finite amount, right?
Mm.
And then what's going on in the area of repair, whether it was, it could just be the time that you had your procedure, like I said, back in the 1990s, when the procedures were, less aesthetically pleasing as they are today. So some of those hair follicles need to be harvested out, repurposed, and reutilized. But yeah, if you're really in trouble, you've been to, like I said, a medical tourism junket or something like that, for a hair transplant in a distant country, there are a lot of hair surgeons that won't even touch your procedure, because it's just impossible to actually perform any kind of significant repair. And oftentimes there's just not enough in the donor resource to actually execute a procedure to make it look normal once again. So it is a lifelong commitment to have a hair transplant, and that's why it shouldn't be done on an impulse. It requires research into your surgeon and their credentials and their experience and expertise and their artistry and their philosophy, and also their facility and their team is all part of it.
And their results, right? Like the aesthetic of the results. I think that obviously is what you're looking for ultimately.
Goes without saying. You better see those results. You better see, what does it look like when it's all said and done and grown in? Is it normal? Is it natural? And trust your gut feeling on those things. If something looks off, you can bet it is.
So I know that there's been some like skin engineering where they're actually growing skin, and it's an interesting situation where they're growing skin to use and potentially like burn patients, but grafting is so effective, like there's just no reason to do it, right? So it's kind of barking up the wrong tree. But I have to imagine. Are they working on growing hair follicles? So then, okay, maybe you talked about having a limited quantity, but if you can start growing them, maybe there's a chance to not have that limited quantity.
Sure. Well, Chris, the holy grail of hair transplant surgery is to have an unlimited supply of available hair, right? Something more than what you're born with around the sides and the back of the scalp. And for today, if you're running out of hair around the sides and the back of the scalp, the next best place is really the beard. And so we do a lot of beard to scalp transplantation. But what you're asking about is tissue engineering, to the point where we have to have a lot of different things happening all at the same time. Biomaterial research has to comport with, the hair follicle duplication and maybe some of that genetic therapy that we mentioned previously. And then how do we get those hair follicles to sit and grow, or the cells within the follicles to sit and grow together? Do we need some kind of 3D culture medium, so to speak, in order to get those organoids to blend together? And so we don't have that yet and ready to go. There are folks around the country and around the world, really for decades, have been trying to do this kind of research. I would say that there are a few here in the United States that are making some progress. So companies like Stemson, for example, based out of San Diego, has some very, very smart people working on dermal papilla cells and combining them with epithelial cells in mice to create hairs that are derived from human dermal papilla cells, as I said, to grow hair. And they were able to get that to work. I think they're having some challenges in the pig model, so we're going to have to just kind of stay tuned on that. But there's a lot of smart people working on it, and obviously that would be fantastic if we can get some kind of an unlimited supply. The other thing that we're seeing, just as long as we're talking about the cutting edge, so to speak, is hair follicle stem cell banking, meaning you could take your own hair follicles and the cells that they contain, which are stem cells, by the way, and bank them, cryopreserve them. And the hope is that not only would you be able to develop some autologous treatment for hair growth that essentially is your own cells and your own treatment tailored for you, but also maybe the hair follicle stem cells could be used for other things that you might need, whether it be for skin or for joints or for bone or for, blood cells, you name it, something that's going wrong. Maybe you can use the stem cells located within the hair follicle that have now been banked when you were young enough. And that's a pretty exciting technology that we're looking at here in the United States. It's been available in the UK and now available here in the US.
So that's banking. Stem cells wasn't even on my radar until just now. You're doing PRP, right? And my understanding is there is some type of stem cell in PRP. Are people doing kind of scalp injections of stem cells and any results with that?
Well, absolutely. There's been a lot of work done on adipose-derived stem cell treatments for the scalp. And I think it's a little bit more difficult to perform here in the US these days because of some of the restrictions and the guidance from the FDA on those stem cell clinics. So most of the stem cell, if you call it that, therapies that we're providing are really in the realm of exosome therapy. So we're not necessarily moving the stem cells around anymore, but we're just taking the biosignals, right? The secretome, if you will, which is what comes from the stem cells, collecting that in a laboratory. They purify, quantify, sterilize, spin it down, ultracentrifugation, and give us, trillions of stem cells, whatever, in a single vial that can be applied topically to the scalp. And those have been very, very helpful for wound healing. A lot of folks are using those as we are in storing the grafts in some cases as they're outside of the body in those exosomes, and stimulating hair growth with them.
Very, very cool. And you may have said, are you doing stuff with exosomes already? And maybe that's part of the phonophoresis, and I didn't catch it.
So sonophoresis, really, the way that it's been designed.
I keep changing the name. We're going to have 4 names by the time we're done.
No worries. So yeah, it was originally, the technology with ultrasonic sound waves was originally called phonophoresis when the orthopedic surgeons were doing it around the knee with corticosteroids. And then sonophoresis is just the more modern term. And we're using growth factors and peptides. But theoretically, anything you want to push through the skin is going to be made easier through that technology. So if you want to push a pharmaceutical agent like a dutasteride or finasteride through the skin, you could do that. Theoretically, you could push local anesthetic through the skin, although that can be tricky because you don't want to numb the skin and maybe hurt yourself or hurt the patient while you're doing that type of treatment. You could also push exosome therapy through the skin using sonophoresis. So there's a lot of interesting tools available today that is combination of methods so that we don't have to inject, because the FDA is very clear they don't want injection of exosomes.
Okay. What percent? So we talked about hair transplant as kind of final solution. What percentage of clients need this, or is this something that eventually, if you want to maintain something, everyone is going to need? What does that look like?
Well, the interesting thing is that over the course of time, I've seen so many more patients who may never ever need a hair transplant. And the reason is because we're getting the word out that early therapies are effective. So an ounce of prevention, if you will, worth a pound of cure. I've seen second generation patients, meaning that the sons and daughters of patients that I've already treated in my practice, from 20 something years ago, 25 years ago, are now coming in at an early time where we can actively prevent their hair loss situation from getting to a point where they might need a hair transplant. But obviously we see patients from all over the world who have severe hair loss and now have the motivation or the ability and the resources to travel and have a hair transplant done, executed in this way. So it's hard to say exactly what the percentages are. I see about 55% male and 45% female patients in the practice. And so many of the female patients are not great candidates for hair transplantation. But again, it's because they're coming in an earlier stage. And so we're using the non-invasive therapies for that. And as I said, there's many, many more patients in the younger age category who are coming in at the earlier stages where we're using these lifestyle interventions, where we're looking at their whole package, if you will, like, and holistically, if we consider it that way, from either a functional medicine approach or other methodologies to really rectify some of the imbalances and to keep their hair growing strong through these situations, and putting them on an appropriate medical regimen and tracking them over time. So whether it's a PRP or other regenerative treatments, they can delay the onset of male and female pattern hair loss and hopefully avoid the need for transplantation, at least for many years. But then the other thing is I'm seeing patients in the vital population over 70, so patients in their 70s and 80s here in Florida and from around the country are coming in very good shape. They're taking excellent care of themselves. They may be biohackers. They may be health and wellness fanatics. They may be planning another decade or two of life at high function, and they want hair transplants. And many of them are healthier than the 60-year-olds I treated 20 years ago.
I think I'm calling it a longevity revolution, right? Like it really is changing. And what you just shared is a story that I've heard more than once during this summit, which is that people younger, right? Like people 25, maybe 35 are starting to look at longevity and in this case, like keeping their hair, where I just was not there. Like, I don't know if you because you're kind of natural proclivity, but I was, still playing on computers, and this was just not on my radar at all back then.
Well, hair was on my radar because I was in the field, but my personal wellness journey really didn't start until I was in my late 30s. And, I can't say it was a complete 180. I mean, it was a slow, twist towards, more healthier lifestyle and healthier choices, as I became more aware of my own body changing and my energy levels and things like that. And so I had to make a change, especially since my wife wanted to know when the baby was due, that things were just changing, but, very brutally honest, but, I made those changes and it's been very, very great. It's been great for me. I've had immense changes, due to all of that and following, the people in the field who are leading the cutting edge in longevity.
Yeah. You said
so many mentors.
The anti-aging since 1998, right? Like that's.
Yeah. So I've been attending those conferences since the 1990s, but I haven't necessarily I've been absorbing the information, but I probably wasn't like following it so well. I was just I was storing it up like knowledge. Right. And then, it kind of hit me, back in my 30s, that I maybe need to take a closer look at things.
And you wake up one day and magically have different habits. No, that's not how it works.
No, it never works that way. And, even in my own practice, we have now a functional medicine department. We call it Bauman Performance. And we know that, it's not a 180. You're not going to dive into the deep end of the pool the first day. So, we've got to make these changes slowly and clip the low hanging fruit first, before we get to some of the more bigger rocks to move. And looking at the hair follicle, starting at the hair follicle, seeing that highly metabolic organ kind of lead us down the path into functional medicine and helping our patients in the health and wellness and longevity space has really been very exciting. Taking my own journey and helping our existing patients kind of move into that realm, has been very rewarding. And that's really the next chapter of the practice. I think that's exploding right now.
That's very cool. Yeah. It's a longevity revolution.
No doubt.
So I've got some wrap-up questions, but before I kind of go down that path, is there anything related to hair and hair restoration that maybe we didn't touch on that you feel would be important to touch on?
Well, look, we covered a lot of, technology and techniques and a lot of jargon. If someone's not necessarily, been involved in the world of hair restoration, I would just kind of sum it all up that if you are dealing with some hair quality issue, whether it's the quantity, quality, color, texture, or of course, losing your hair specifically, the earlier you seek treatment, the better. And so I think the take home message for any listener, especially in the world of longevity, is that the earlier you seek therapy and treatment, the better off you're going to be, like an investment in something that's going to grow long term. And that's certainly going to be your hair. So as we say in the world of hair, it's the investment that keeps on growing. When you tackle it early, the treatments are always less invasive and less expensive, and you won't need as many of them, obviously, if you attack it early on and get the proper evaluation and get on the right path. And I think what we do at the practice here at Bauman Medical is something that's a little bit different than many other practices, whether it be your local dermatologist who may not be focused on hair at all, or even hair surgeons who are just kind of focused on the surgery part of it and kind of missing out on all of the preventative and regenerative and holistic, pieces of the puzzle that I feel are really, really important, not just to maintain the hair, but also to improve your recovery process from a hair transplant if you need one.
Okay, excellent. All right, here are the wrap-up questions. Do you have a target age that you want to live to?
So my goal, longevity-wise, I love to ski. I don't get a chance to do too much of it. I have at least one big ski trip per year, but my goal is to be able to ski at 100.
At 100, I like that.
So that's my aspirational goal, and I train all year round, physical fitness wise, so that I can survive my ski trip each year.
So I can hobble back and get ready for the next year.
Exactly. So I do train all year round, just for the sheer goal of being able to keep up with my friends who are on the ski trip, and also to make it to the next year. And so, my goal. So I would say, so I have to live to 100 to make that happen, of course. So, is it going to be, am I going to hopefully not drop dead on the ski slope at 100? So maybe let's call it 105. Okay?
Check and then done, right?
Right. I'll just fall over and that'll be the end. But, that's the whole idea, right? To push out the lifespan to the point where the health span is improved all the way out. And then, obviously not have any long extended debilitating issue, for that detrimental decade or whatever it's called, at the end of life. We're all trying to do that. So everything works backwards from there, right? So, some of my mentors talk about the centenarian decathlon, if you will. And so that's the list of things that they want to do when they're 100 years old. And so, if you want to be able to lift a toddler over your head, from the ground up, so to speak, there's some certain ways that you would prepare for that today. As you go from, where I'm in my 50s into my 60s, 70s, and 80s, I want to be able to do that. So I've got to work a little bit harder now, because I know it's going to be more difficult to maintain muscle mass and strength and stability and coordination and all that as I continue to age. And so that's the battle that I fight, twice a week at the gym, I
guess. All right. How old do you think humans can live?
So that's an interesting question. And, I've heard some answers of that that vary, right? And so a lot of folks aspirationally, I want to live to 180. And some of my mentors are a little bit more
aspirational or aspirational.
Oh, very good. Yeah. Yeah. And so, that's great and fine and good. I think, some other folks are a little bit more conservative on the estimates of what's the, unless there's some radical breakthrough within the next 5 to 10 years, I think that, we're going to be pushing out that extra decade. And I think that that's an appropriate kind of number. One of the podcasts I listened to was a business oriented podcast, I think. And the host asked the person who was the business advisor, what was the most powerful thing that you've ever done over the course of your 30 years of talking to business owners about, what was the most important thing that had the most incredible effect on them? And what he said was changing their perspective in terms of longevity. And that, because if you figure, well, if you're gonna kick the bucket at 82, but now you're going to live to 92, what would you do differently? Like your whole mindset changes if you have like another 10 years in terms of that runway, right? And so, I don't know if that really answers your question, but those are the things that I think about sometimes, when it comes to the longevity aspect of things.
I like that. In fact, I did just publish a book, but the original working title was Reinvent Yourself as if you're going to live forever, because you might, right? And that is like, if you throw on 10 years onto the end, 10 good years onto the end of anything that you're imagining, it could mean you need to work longer to have the right savings. It could mean, you need different relationships or better, to figure out how to improve the relationship. Like there's so many factors that need to be managed. And that's kind of the title here, Live Beyond the Norms, is kind of that whole concept. All right.
No, it makes sense. Like, look, if you leased a car and you turn that car in 3 years, right? But it's different than if you own the car and you're going to have that car for 50 years. You probably would change the oil more, right? You probably would.
Yes.
I'm a car fanatic, so I always think about things like in terms of maintenance. Like, oh man, I got to change the oil more often. Got to make sure I hit those things.
Take care of that baby. All right. What are 2 to 3 protocols, habits, mindsets? Let's call them shortcuts, because everybody likes shortcuts, that you would share related to longevity and a long health span?
Yeah, well, I can only speak from personal experience. So one of the first things I changed was really my nutrition and eating habits. And so I changed a little bit about what I eat, although I am a foodie. So I do take a lot of pride in eating a variety of different foods. And I think that that's helpful too. You don't want to be eating the same thing every day. But I do intermittent fasting during the day. So it's really time limited feeding. So on a work day, I've changed my eating hours so that I really have a snack or cold lunch at around between 1:30 and 2. And then I'll have a regular dinner with the family, my wife, and so forth at the end of the day, usually 6 p.m. or so, 7 p.m., sometimes a little bit later if I worked out that night, but usually from like 8 p.m. until 2 p.m. the next day, that's my fasting time. So I am on that either 18-6 or 16-8, kind of pathway. And that's worked very, very well for me during the week. And then, of course, on the weekends, it's kind of like, whatever works, whatever, anything goes, so to speak.
Yeah.
I'm not like tied to it. So it's not a daily, it's only the work days, which I find are much easier to deal with. And during that fasting window, black coffee, and years ago it was buttered coffee. But those were the kinds of things that I would do. And it really made a huge change. I mean, way back when we talked about, changing my lifestyle, I lost weight and I felt better. I had a lot more energy once I started to make that particular change. The other thing I focus on a lot is sleep. If you see the Aura Ring, obviously I've been tracking that for, I'm on Gen 3. I've been since the first generation for many years. So it's like 5 or something years, 6 years maybe with the Aura Ring. And I do my very best to try to sleep better. I have figured out that I really can't sleep any longer because of my work schedule during the week. But I really take a very, very strong approach to trying to hack the system and try to get a little bit more deep sleep. It's always more difficult as you age. And so I've got a couple of things that I do: preparing for bed, turning off the blue screens. I've got blue blocking glasses, red ones at night if the TV is on. And then, cooling the bed. I've got the Doc Pro from Sleep Me. Before that, it was the chili pad and so forth. So really making sure that my environment is tuned so I get the deepest and best and quickest sleep that I can during those hours. And then the third thing I would say in terms of my regimen that I think is the most important is the physical fitness aspect. Mm-hmm. I'm not really good at zone 2 cardio, so I have to be honest, I'm not so great at that, but I do like to lift heavy things, and I do that twice a week, like I said, pretty hard, so that I can not die on my ski trip.
You gotta have life goals.
Yeah, so that's what I do. I mean, it's it seems crazy, but that to some perhaps, but those are some of the basic things that have really made the biggest impact, for me personally. And everybody's a little bit different. I meet all people from all walks of life at biohacking conferences, the anti-aging conferences, the traditional medical conferences, and I have to say that the people at the biohacking and anti-aging conferences, they just look better. They look younger. They have more energy. They have better mood, better attitude. Better body posture. They have more success in their life, personally and professionally. And, it's just an observation. And I can say very, very specifically, because I go to a lot of conferences. I'm asked to speak at a lot of different organizations. And I like when I'm involved with the health and wellness world, because I feel like, they're speaking my language and vice versa. So it's, if anybody's out there, American Academy of Anti-Aging this year, December, I'll be there on the podium, but also just hanging out. Seeing what's new and what's different, and learning and sharing the great information out there in Vegas in December.
American Academy of Anti-Aging. That's really awesome. So that's a place they could bump into you. How could people contact you?
So patients and those with hair loss questions and concerns connect with me from all around the world through the website, which is baumanmedical.com, BAUMAN medical.com. And whether you want to start your hair restoration journey there by scheduling a consultation from your home or phone virtually, or if you want to schedule something here in my practice in downtown Boca Raton, Florida, South Florida, just about an hour north of Miami, we can do that here too. Even if you just want to ask a question, you can go to baumanmedical.com/ask and type in any question. And through my team, I'll respond and we'll get you the answers that you need. If it's something that I don't know, great. You can try to stump the doc. That's awesome. I love that, and hopefully we can get the information out to you. But I would just say that if you're out there, as I've said before and many times, an ounce of prevention is worth a pound of cure when it comes to hair loss. So if you think that your hair is thinning, it probably is. Let's take a look at it. Let's get some testing, at least some baseline evaluations, maybe genetic testing and such, and the hair measurements done. And let's see what's going on there and see if we can help you. If you like your hair and you want to keep your hair, that is. That's what we do at Bauman Medical for the past over 25 years, actually.
That's awesome. So I suspect you might get a lot of questions about like which cow licks actually grow the most hair. I don't know, maybe after this talk. All right. And what in the near future are you excited about?
Well, as I mentioned, we launched the Sonophoresis technology here in the United States. We were helped part of that. We were the first board certified hair restoration. I was the first board certified hair restoration surgeon outside of the clinical trial that was originally done in the Chicagoland area to be able to implement this into the practice and to use it. And so that technology, being able to speak about that around the world to my colleagues, some of whom can't even get the device yet because it's not even available in Europe or Asia yet, but also to tell patients about it and to have another amazing non-invasive tool in the toolbox has just been so much fun and great. And the second thing is the launch this past year of the Bauman Performance Program, really looking at performance medicine, wellness, longevity, and everything from hormone optimization to lifestyle management and all of that business, plus all of the biomarkers that we can do to help people extend not just their lifespan, but their health span. And on top of that, their hair span is what I've really been excited about. So, that's been a super cool part of having the practice here in Boca and having our patients who are really, again, stepping in line with us in terms of this longevity process. So Bauman Performance, you can go to baumanperformance.com, fill out a form there, or you can just do it through the regular website if you're interested in that kind of a program as well through baumanmedical.com too.
All right, excellent. So you can find them again, Bauman Medical. That's BAUMANMEDICAL.com. I really appreciate your time today. Thank you for joining us,
Chris. It's a pleasure to be with you, and thank you for having me.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit MyVitalC.com. That's MyVitalC as in carbon.com.